On behalf of the Employer Commissioners Bargaining Health Benefits for Vermont Public School Employees, I'm going to do a comparison of out-of-pocket costs under the current situation and those proposed by the Employer Commissioners as of fact-finding in August of 2021. Out-of-pocket costs are copays, deductibles, and coinsurance that the health plan, VHI, doesn't pay for, but is the responsibility of the employee and the employer HRA. As a reminder, most school employees are enrolled in the Gold CDHP plan. For a single person, before any HRA is taken into account, there's a $2,500 maximum out-of-pocket cost in a calendar year. And out of that, no more than $1,400 could be towards prescription drugs. For all other plans, the family, the parent-child, or the two-person plans, the maximum out-of-pocket before any HRA is $5,000, and the maximum towards pharmacy is $2,800. Now keep in mind, no public school employee has those exposures. Currently, a person in a single plan has an exposure of $300 if they're not a licensed employee, or $400 if they're licensed. In all the other plans, the exposure is $600 if you are an unlicensed employee and $800 if you're a licensed employee. Now keep in mind, whatever out-of-pocket cost an employee ends up with at the end of this round of negotiations, they can use a flexible spending account, an FSA, to set aside those dollars pre-tax. So every dollar that they set aside can actually cost them about 70 cents. The average tax savings of not having to pay state, federal, Social Security, and Medicare taxes is a savings of about 30%. And also remember that if they set aside $1,000, for example, in their FSA, that $1,000 is available to them in a debit card on January 1st, but the $1,000 is actually taken out of their paychecks throughout the year. So let's look at the current arbitrators award that's in effect from January 2021 through December 2022. Now, an employee actually needs to have $5,300 in claims in order to draw down the full $300 out-of-pocket exposure. You can see that I'm talking about a non-licensed employee in a single plan, but the concept holds true regardless. Also remember that that $5,300 in claims does not include any preventive care they need and any of the wellness medications that are always covered 100% by VHI. Wellness medications include medications for diabetes, high blood pressure, cholesterol, osteoporosis, prenatal vitamins, and several other areas. So in the Gold CDHP for a single person, the deductible is $1,800. That entire deductible is currently paid for by the employer HRA, because remember that HRA is worth $2,200 for this particular employee. They have only a $300 exposure. So as their deductible comes through, the employee pays nothing. After the deductible is met, VHI actually starts paying 80% of a claim, and the employee is responsible for 20%. But in this case, for the next $2,000, there's still money in the HRA. So VHI would pay $1,600 and the HRA would pay $400. So the employee has not yet spent any money. 72% of that maximum out of pocket has been paid before the employee has spent a dollar. Now, if the employee continues to need health care over that $3,800, they pay 20% of it because VHI is continuing to pay 80% of it. So for the next $1,500 in health care, the employee would pay their $300, VI would pay $1,200. At that point, the $2,500 out-of-pocket maximum has been met. The rest of that $5,300 has been covered by VHI, and anything further is covered by VHI for the rest of the calendar year. Now let's look at what the employer commissioners have proposed to be in effect for the years 2023 through 2025. The employee would still need a minimum of $5,300 in claims, excluding preventive and wellness RX, which will continue to be covered 100% by VHI, to draw down the full $1,250 out-of-pocket exposure. Because the employer commissioners are asking school employees, all school employees, to have $1,250 for single or $2,500 for two-person parent, child, and family plans. And I hope you'll understand why as we go through this. So the deductible is still $1,800, and the HRA will pay the first $1,250 of that deductible. If the employee has more than $1,250 in claims, they will have a $550 deductible. Now, that's important because this is where employees begin to engage in noticing the cost of care and in helping to reduce low-value care, which is discussed in a different video. You might remember that the pharmacy maximum is $1,400. The HRA is $1,250. That leaves the employee with an exposure maximum of $150 for prescription drugs in a year. Under the current situation, the HRA is greater than the pharmacy costs, and most employees will pay nothing at the pharmacy for the entire calendar year. And yet, pharmacy is one of the most price sensitive to consumers. People are more incentivized to pick a generic drug or a preferred brand drug when they have some share of the cost of prescriptions. And that can lower VHI's claims dollars, as talked about in a different video. If the employee needs more care after the $1,800 deductible is met, VHI will pay 80%, and the employee will pay 20%. So the other $700 that the employee is being asked to share in is actually spread over the entire coinsurance. Once that out-of-pocket has been met, VHI will pay 100% of all medical needs of this individual for the rest of the calendar year. The employer commissioners feel strongly that in order to help employees partner in reducing low-value care, making sure every dollar paid for health coverage, whether it's medical or prescription drugs, is being wisely spent and helping reduce future premium increases, that they need to have some exposure to pharmacy, some exposure to the deductible, and more incentive to be engaged in the cost of care. We also believe that these health plans are still very competitive, and that will be covered in the next presentation.